get the AED.
Okay.
Oh, please help him.
Opening the victim's airway is the first step in the ABCDs. When a victim is unresponsive, the tongue falls back and blocks the airway. Opening the airway lifts the tongue off the back of the throat, allowing air to flow into the lungs. Sometimes this is enough to help a victim start breathing again. In this segment, we'll review 2 methods to open the airway. The head tilt chin lift is the primary method. It's used when a neck or back injury is not suspected. The jaw thrust is used when a neck or back injury is suspected, or when the event is unwitnessed. First, we'll take a look at the head tilt chin lift. Remember, before we start the ABCDs, assess for response by tapping and shouting at the victim, then activate EMS and get the AED.
Sir, you okay? You, call 911, get the AED, and hurry back.
To open the airway with the head tilt chin lift, place one hand on the victim's forehead and 2 or 3 fingers on the bony part of the jaw next to the chin. Tilt the head back and lift the chin. This position prevents the tongue from blocking the airway. The head tilt chin lift is the most effective way to open the airway. If the rescuer suspects a neck or back injury, or the arrest was unwitnessed, open the airway using the jaw thrust. To perform the jaw thrust, position yourself at the patient's head. The goal is to open the airway by lifting the jaw without moving the neck. Rest your elbows on the surface the victim is laying on. Grasp under the angles of the jaw near the ears. Carefully lift the jaw forward without moving the neck. If the lips remain closed, use your thumbs to gently separate them. A word of caution about the jaw thrust. It is not an easy maneuver, and it requires a lot of practice. Even experienced rescuers sometimes move the neck when attempting the jaw thrust. If you attempt the jaw thrust and are unable to open or maintain the airway, use the head tilt chin lift. The head tilt chin lift and jaw thrust work with both children and infants.